A world faced by more and more natural disasters. Earthquakes, hurricanes, tsunamis. Leaving a trail of brutal destruction, catching countries unprepared. Public health systems like poorly constructed dikes, rapidly overwhelmed by the raging storms and eruptions, unable to cope with the scale of human suffering. Stock exchanges, markets, and corporate profits command a much higher priority than disaster prevention and world health. But it is a small Caribbean nation that is doing most to challenge these trends. Pioneering preparing for natural disasters, this Caribbean island has set a new agenda by globalizing healthcare for the poor. Only 90 miles from the coast of Florida, Cuba has survived more than 4 decades of a US trade embargo, defying the hostile superpower breathing on its doorstep. In spite of Washington's efforts to isolate the country, this Caribbean island attracts more than 2 million visitors a year with its vibrant culture, arts, music and lifestyle. After 1959 revolution, Cuba embarked on a very different path to other developing nations. The revolution had promised health and education for all. The dream of a better future, where every child goes to school and every family has the right to see a doctor, soon became a reality.
In Cuba, the most important thing is the education and the health.
You organize your resources according to those priorities.
I'm a family doctor and I work in Ulgova Polyclinic.
It's Dr. Alberto Denis Perez. I'm a vice director of the Matanzas Provincial Hospital.
The results of our works can contribute to the health of people.
You have people you can train, you can do a lot of things.
Yes, we treated many people in the world.
We really are making a big effort to contribute not just to solve the problem in Cuba, but worldwide.
A comprehensive health system to serve all Cubans was starting to take shape.
Health became a priority in the 1960s, and health and education. So really early on, land reform and access to education were considered the pillars of the Cuban Revolution, but health became immediately after a priority, and it has remained a priority. Tuberculosis was what considered the most important public health problem in Cuba in 1959. In the area of tuberculosis, Cuba introduced a level of care that is considered today standard worldwide, but they introduced it in the early 1970s, so much ahead everywhere else.
This doctor brought healthcare to people in Sierra Maestra Mountains after the triumph of the revolution. It was the first time that Cubans living in remote areas had access to doctors. By 1959, nearly half of the island's 6,000 doctors had left the country, fearing an end to private healthcare. Cuba not only recovered from this stunning blow, but today it leads the world with 1 doctor for every 170 citizens, a better ratio than nearly all Western countries.
And then it was later that they created the family doctor program. They are very familiar with those families, and they live in the neighborhood, and they are actively making sure that people are taking care of their health.
Buenos días. ¿Cómo está Leandro? I'm a family doctor and I work in Ulgova Polyclinic. The work here is to visit another patients. Now I have more patients because There is some doctors that is in international missions. Our work is to prevent the illness. For example, we promote the health, we talk with the patients, we act into the risk factors. In the case of a child, you see the indications that we made to the mother, preventing the infections, the diarrhea, that promotes the breastfeeding, to promote the hygiene. ¿Cómo te sientes hoy?
No, me siento bien.
¿Te sientes bien? Okay. These are scars of an infection, these infections attacks the nerve. When I was a little child, I always get sick. I wish that the persons around me are healthy. And besides, I like to help the people.
After seeing family doctors, patients can be referred to a polyclinic for further tests, treatment, and minor surgery. The polyclinics provide many different services, including X-rays, ultrasound, dental treatment, and traditional medicine. Acupuncture and herbal medicine in Cuba are viewed as an integral part of a holistic health system, combining the modern and the traditional. Research in Cuban hospitals has shown that these needles can be effective not only in pain relief and migraine headaches, but also in neurological problems, such as the treatment of Parkinson's disease. Many herbal medicines that Cubans refer to as green medicine are available in the pharmacies and are used as an effective alternative to prescription drugs.
Dice lo que es la terapia floral y la homeopatía, que son tratamientos que se le hacen también a los pacientes.
In the Western Hemisphere, I think we are the only country that has alternative medicine as officially as part of the national healthcare system. It's useful, it's cheap, it has little side effects. It has its place.
The island's lifestyle and sexual freedom made it vulnerable to the HIV/AIDS virus as it spread around the world in the 1980s. The authorities, fearing an epidemic, quickly responded to the challenge.
Cuba was preparing against HIV/AIDS since 1983, when we started hearing the news about the syndrome that was happening in the United States.
The Caribbean region has the second highest rate of HIV infection in the world today. But in Cuba, it is a very different story. Its success in achieving one of the lowest rates of infection has been based on meticulous research and a dynamic public education campaign. Openly talking about sexual behavior is not a problem in today's Cuba.
Okay, my name is Malena Perez. I live here in Cuba and I'm a health promoter. I work here in the National Center for Prevention of Diseases, STD and HIV. Sometimes people call and ask, you don't know who I am, you don't know my telephone number, and we say, no, this is confidential, we don't know nothing about you, you can talk free, everything about you want to talk. In many places here, hospitals and clinics, we have the people who makes the test free for Cuban, and it's confidential too.
Muy importante.
we would like to give the HIV person the best attention that we have. And in the year 2001, we start producing the generic medication to treat AIDS.
There are still AIDS sanatoriums throughout the country, and people have the choice of going to live in a sanatorium at least for 2-3 months, or staying home and receiving ambulatory care.
Yo decidí no reincorporarme a la vida social, ¿no? Porque me siento más útil ahí, porque hago labor preventiva con las mismas personas que de los nuevos diagnósticos que viven con VIH y con la población en general.
We are in the 18 countries around the world that has less than 0.1% of the population infected. So we have 0.07. Okay, so we are really, the rate is really, really low, but it's still a possibility of getting AIDS. Okay.
It's a success. We are 11 million people, and we only have 6,500 people with HIV.
In common with tropical tourist paradises in the Third World, many Cubans suffer overcrowded housing, poor transportation and low salaries. This economic crisis has been a daily reality since the early 1990s. But what sets this Caribbean nation apart from other poor countries is the development of first world medical expertise and educational standards.
We are not a rich country, but we have now in health some results comparable to the more developed countries. And I think that our scientists are very motivated people. I think that they enjoy what they are doing.
I've been working here for 6 years, and I love this institution. I love the work I do every day. First of all, because this institution contributes a lot to my development as a professional, but also as a human being. I'm excited with the work I do in my daily life. The results of our works can contribute to the health of people. We can see, well, I work in that part of science, but perhaps in 2 years, the product I work with is in a clinical trial. The link in the things I do in the lab, and perhaps in the future, in the hospital, a patient is receiving that antibody that was born here in the lab.
That we should have not just biotech, but all that we can call high-tech industry, in which human resources are the more important asset.
Cuba caused a stir by being the first country to develop a meningitis B vaccine back in the 1980s. Here we filmed UK and Cuban researchers at Havana's Finlay Institute in 1999, working together on the vaccine's potential for use in the UK. A different vaccine has been developed at the Center for Biotechnology.
We're producing here the hepatitis B vaccine, for example, which is a real good example because there is only 2 really good vaccines in the world of that kind. So one is produced by SmithKline Vision and the other is produced by us.
This hepatitis B vaccine is exported to more than 30 countries. Unable to access medicines from the US, Cuba has been inspired to discover and develop its own vaccines, most definitely an unintended effect of the US trade embargo. The island's biotechnology industry is recognized as one of the world's best, with medical sector exports and tourism now taking over from sugar as the main pillars of the economy.
I think that we are making a contribution in the cutting edge or in the borderline of the cancer research to make a contribution to the mankind, I mean, considering the treatment of cancer.
But Cuba's wealth cannot simply be counted in dollars and GNP. It lies in the quality of its doctors, medical services, and education system.
There are not many companies in the world that they target cancer in the way we target. We are focusing now, instead of seeing a cancer as an end disease, we are targeting cancer as a chronic disease, that the patient can live with this disease for life, like we treat today the autoimmune diseases as diabetes, rheumatoid arthritis, that you treat as a chronic disease, receiving injection every 2 weeks or even one a month.
This vaccine can be used to target cancerous cells without harming normal cells. It has attracted international interest and joint venture agreements to market Cuban anti-cancer drugs in Europe and Asia.
I think that